talking in regards of the ninth semester and the 10th semester, in which we are uh, looking for to record all these classes on to the medicine doctor training. There is going to be a series of rotations. These rotations receive the name like that and as signatures to different parts of the hospital in where the student learn how to develop and um, have the opportunity to put hands on patients um, during the training on rotation. A list of students where each one of them is going to be assigned to different places, such as emergency. Perhaps some of the students will be have the chance to travel in some of the ambulances. It's not very common, but sometimes when there is not enough people in the building, volunteers are taken, and usually students are the ones who volunteer for this kind of mission. Therefore, students will be assigned to emergency, and eventually they will be assigned to general medicine, right? General surgery, orthopedics, rehabilitation, mental unit, oncology, dialysis, cardiology, geriatrics, and maternity. It will be taken into the consultations, whether if it's going to be admitting the patients for general examination or for any chief complaint. Um, Therefore, the laboratory is going to be also having right cytology. It's going to have pathology, autopsies. It's going to have hematology, microbiology. It's going to have neurology, um, and all the specialties that there are right into the general circuit is going to have their clinics, right, with a team of specialists which are going to be playing an important role into make meetings when the pre-diagnosis is effective and eventually the diagnosis is clear, right, from the laboratory and all the testings the students and put the patient through, right. During this session of rotation, the students are going to be freely having the opportunity to fill up all kinds of sheets that there are have to be into the medical records, right? And as we were talking priorly and some all these introductions and chapters from 1 to the 5th chapter from all the books of medical medicine training. Um, we see how all these tests and all the abbreviations, right, and all the data have to be constructed into the records, the medical records. All the data has to be and complete in order to have it available um, for the next time the patients and for future assistance from the clinicians. When the student is assigned to general surgery, we're going to see all the clinics that there are available according to all the specialties that there are. And there is going to be a building of pre-operative or pre-prepare the patient for surgery, right? And as the patient goes into surgery, right, having the assistance of other already graduated and other students which are in above levels in their specialties, right, working with patients, right, um, prepare the patients for surgery, right, having all the environments, right, uh, safety precautions, all the cares for environmentalistics, all the cares for sterility, all the cares for to the disposable of all the contents that there are taken from the human body, right? And all these areas have their department where there are assistants, which are technicians, right, and assistants which come up to the scene as the surgery is right done in order to have the environment clear from all kinds of impurities. After the surgery is performed, right, the patient is carried into the post-operative care where the patient is attached to equipments, right, and where the biomedical um, bachelor degree students come into or specialties or biomedical equipments come into the picture, and as well the specialists very well known of their equipments and everything that is needed in order to to bring the patient normal living conditions to very well and standard and normal living, right? The students learn all kinds of equipments that are attached to the skin, to the vein, to drain all kinds of uh, liquids coming from the human body. And that way, for how long they have to be, and the surveillance and the paperwork that is required in order to have them attached to the medical records to see the progress of this patient, right? The general surgery will have, right, the opportunity to have a room, right, which after each use has to be placed, and where another team of technicians will come to hire a company, right, to be able to sterilize, to be able to do the required cleanup, incineration of species that there are getting out from the human body, right? Or the same hospital, right, gathering all the special teams to finally get rid of all these contents, right? All the soil and everything that there goes into a specific area. It has to be very well known by every kind of students, right? So that way um, we avoid contamination of any kind. The department of orthopedics is going to be also, right, in the hospital, and where their equipments, right, and the very sensitive and delicate care for, right, do the medication that there is given um, requires 100% surveillance, right, and people who are screened from any bad background do that. Most of the surgeries done in the bone have to have the pharmacies and the dosages that are compromising, right, the life, right, of the patient. It has to be surveilled each 30 minutes, each hour. The person has to be changed from their positions, right, or as the patient requires to have it changed, right? Because the type of surgery, which is in the bone, right, it really requires a good team of three people to help to move, and along with a very good equipment such as electric beds, right, which will allow the patient to lean, to sit, and to stay on the sides along with pillows and some other kinds of um, uh, uh, aids, equipment that come handy for the patient, right? To have an interview with family members, and to sit down and talk um, in regards of the conditions of the patients, right? In order to recheck the dosage of all the medications is always very important to avoid the overdoses of patients, and to calculate the drops, right, of any physical IV that there's administering intravenous, right? And to the cardiac side also, there are monitors that they're checking, right, each one of the patterns of the condition of each one of the patients that there are in hospitals, right? And it has to be done according to schedule, and it has to be done according to their cardiologist, right? On dialysis, right, the equipment and everything that is required and administered, it has to be um, carefully watched, right? And especially for all the people who have high risk of any other kind of syndromes related with a resulting have dialysis done um, periodically. The oncology is offering, right, um, a lifetime survivors a chance to apply different kinds of treatments which probably will reverse, with the hope to reverse any kind of illnesses that they might experience. And uh, the life support that they have their bodies into, they are providing the care per 5 minutes, per 10 minutes, per 15 minutes, per 20 minutes, right? Um, which are a very, very, very small droplets, right? A very, very, very small amount of substances which goes into the vein, through the vein, or another kind of treatment that the machine is providing, right, or semi-robot, in order to bring the life or the normal vital signs into the specific site of the human body. And there are machines which are reporting according to their sounds what is going on and what is all about, right? And this is something very innovative and is very interesting, right? On the side of the mental health, the people with mental problems, right? There are in the hospital. They have been hospitalized because their chronic complaints was having bothering them for years, right? A lot of people, they look normal, right? They walk around, they serve themselves coffee, they sit on their beds, they sleep, they sing, and some of them, they might have hallucinations, they might have problems holding their clothes. Some of them, they might have some other kind of problems related with specific parts of their human body, which is very important to keep checking them each 15 minutes. And the rounds for the specialist, it has to be to take the rounds of each 15 minutes to write in each one of the records what's going on, what is noticed, what they do, if they are home, if they are crying, if they're sleeping, if they are just looking at the ceiling, if they refuse to walk, if they're unconsciously present or just breathing, right? Um, they have to check the times the medication has to be given, and also to find out if they have problems swallowing medication, pills, syrups, or things like those, in order to find out another ways to provide the medication that there are. Nowadays, with the innovation of all this type of medications, probably people don't need to have swallowing or to have to swallow pills or tablets. The Department of Maternity, they have the clinics, different kinds of clinics in the same unit. There is the screening for pregnancy, the clinic for the sessions of lactancy, right? So they learn the periods and what to do in order to probably preserve the liquid coming out, right, uh, from their glands. There is the clinic of, or the preparation for delivery a child, right? And there is the place to deliver the child, and there is this side of postpartum, right? The pediatric side, right? It's a very important side, it's, especially when the children are born underweight, right? Incubators and nurse care and pediatric care is very important. Also, the gynecologist and the obstetrics, right, which come in hand when the person would like to keep the children and send home still with some remaining time to for their pregnancy to be over. The gynecologist, which is the clinic, which is barely attached to the postpartum, comes in place because some of the ladies probably have some contagious diseases which have to be watched very carefully and care, right, for virulous um, sexual transmitted diseases, which um, it is very important to treat all these kinds of illnesses, um, to be sensitive, right, and to be able to treat them with respect for many reasons, right? There is the autopsy department, right, um, which is associated with pathology and where all the corpses are, right, or have to be given the examination in order to find out the reasons of death, right? Because usually when the person comes to see the doctor or to the hospital or hospitalized, it's because they can deal no more with a specific pain, right? But when the person has a specific pain, sometimes it's given because they have already three or four things bothering the person, which means that there is not just one chief complaint. There might be four things that are bothering the human body, and they complain about only one, and that's what is treated. But as you go through the human body and you see what's going on, you see eventually that there's not just one chief complaint, right? And sometimes as the students sees, right, that there's not just what the patient is talking about, but some other things related. It is something sometimes very important to write it down and in the record for further assistance, right? The rehabilitation side or unit sometimes is used for the people who have come out from orthopedic surgery, right? And they have to go further exercise for another 30 or 90 days, and they have to wait, right, for the Department of Social Security to bring the housing where the person is going to live, because usually or most of the people who have problems going to rehabilitation is because they have to wait. Meanwhile, they have the rehabilitation in order to go through their periods of living conditions, and they decide to go and live on their own, right? They have their housing, and they have to subtract the payments for the housing, and eventually receive a check for their food and some other bills to be paid, right? And sometimes because they will have to move from another side of town and they're waiting for ambulances, probably because they will go and move to live with another son or another daughter, another relative, and they're waiting for the family to come and pick them up. The laboratory, hematology, all these testings, the blood bank, right, routes are very important to uh, go around and check all the sheets and all the information in regards of early reports in regards of the patients that they are under observation, right? And this will provide a way to see if the patient is ready for dismissal, right? And therefore they can go back to live their normal lives, right? There are so many departments and some other clinics, right, as hospitals are available, especially the surgical sterilization and which are very important to check, right, uh, in order to find out the ways the people is putting order around where you're walking, where you are living, where you are breathing, right? In order to find out a better ways to serve the community, it is important to get informed and that a way to have a better ways to live. All these rotations, right, are going to be according to the availability of the clinics, the size of the clinic, and the amount of patients reporting daily, right, outside, right, and all the people which have to be hospitalized, right, and which is very interesting in regards of care for vaccination of children, right, in regards of general examinations, right, in regards of um, any kind of service from any kind of attendant or any nurse, which have to be sent according to the need, right, of the person, especially on geriatrics, right, which is the side that it requires a lot of nurturing, right, because the people are not moving, people are not reacting faster, right, as they used to, right, because they don't longer have a need, because they don't longer have to rush. And even though if they worry, they might not be able to walk as fast as or to run or to do anything at all. So to be very sensitive in regards of these people, right, and to nurture and to care, right, to care for their grooming of patients and to learn all the steps required in order to care for their skin and to teach them how to learn new ways to take baths, how new ways to dress themselves, and probably another kind of fibers, another kind of linen, right? Probably to help them out to choose a smaller room, perhaps a smaller house, perhaps, right? Taking in consideration that they are part of the family, and probably to have a meeting with the family members in order to see if the size of the houses are really big and they don't have all day long to be cleaning the house and to be really environmentalizing all the pantries and cleaning all the curtains and really get rid of all the rugs and do all this vacuum cleaning of everywhere, right? And so all these things becomes a very important focus in geriatrics, right? Um, the side of family medicine, right, is also very interesting. And this is a trip, right? We are taking you around the service of the rotations that is going to be given, right, into the training of medicine doctor, right? We'll be back with you shortly with more information.